Hi, my name is Dr. Misbahi, a medical physicist specializing in radiation oncology. In this presentation, I will discuss electron beams, their interactions with matter, and dosimetric properties relevant to treatment planning. First of all, electron collision can happen with other electrons and a nucleus in the matter. Electron interactions with other electrons occurs in two main ways, elastic and inelastic. In elastic collision, the incident electron scatters without any significant loss of kinetic energy to the target atom. In inelastic collisions, however, the incident electron loses some of its kinetic energy, which is transferred to the atom. This energy can excite bound electrons or even ionize the atom, producing photons or free electrons and ions. This figure here illustrates the two key types of inelastic process. In the upper diagram, the excitation happens. The incident electron collides with a bound electron in the atom and transfers just enough energy to promote it to a higher energy level. The electron remains bound, but the atom becomes excited. Later, the excited electron returns to its original state, typically releasing the excess energy as a photon. And in the lower diagram, which is about ionization, the incident electron transferred sufficient energy to completely remove or eject the bound electron from its orbit. Part of the energy overcomes the atom's bonding energy, while the rest is shared as a kinetic energy between two outgoing electrons. Now we can talk about the electron interactions with atoms. We have elastic and inelastic collisions like electrons, which can happen with the nucleus. In elastic collisions with nucleus, electrons mostly just change direction after interacting with the nucleus, but their energy remains essentially the same. You can see this in the bottom part of the figure. The electron path is deflected, but its kinetic energy is unchanged. Now, in elastic collision, on the other hand, it is a little bit different. Electron lose energy. Part of this energy is emitted as a Bremsstrahlung X-rays, which is the type of radiative energy loss. And the electron direction and energy both change due to Coulomb force from the nucleus. And Bremsstrahlung photons are generated. It is the main mechanism used for X-ray production in X-ray tubes. The electron can lose energy all the way down to zero and give all its kinetic energy to the produced X-ray. We have the concept of the range for electron beams, in contrast to photon beams. And range is approximately the distance, and it is how far electrons can travel in a medium before stopping. So it will be in terms of centimeter or millimeter. It depends on the energy of the electrons, and the range of electron increases with the energy of the electrons. It means that higher energy allows electrons to penetrate more in the matter. So when the electron as a charged particle enters the matter, we know that electron is surrounded by its Coulomb electric field and therefore interact with electrons and the nucleus of every atom it encounters. Most of these interactions individually transfer only minute fraction of the incident particle kinetic energy. It is convenient to think of the electron as losing its kinetic energy gradually and continuously in a process, often referred as a continuous slowing down approximation. It is CSDA, and we come across with this term in the electron physics books. It is a type of the range can be calculated using the stopping power of the electrons. And you can see in the slide here, we have equation to calculate the CSDA range for electrons. And the other thing is that it is very important to know is the concept of the path length and the range. Path length of a single electron is a total distance traveled along its actual trajectory until the electron comes to rest, regardless of the direction of the movement. And we have compared it in this figure. As if you look at the range and path length, they are different in terms of distance and concept. Now, it is very important to know how to measure the dosimetric characteristics of the electron beams. In radiation therapy, we use water phantom, a large tank of distilled water that mimics human soft tissue, to precisely measure how the radiation beam behaves. A water phantom typically uses two ionizing chambers, a reference chamber and a scanning chamber. The reference chamber is fixed in a position and continuously monitors the LINAC output to correct for any beam fluctuations during measurement. The scanning chamber is mounted on a motorized arm inside the water phantom and moves in 3 dimensions to measure depth dose curves, beam profiles, and output factors. To understand how an electron beam deposits those, we move a small chamber through a water phantom and measure the dose at different points in the water. In practice, we focus on 2 main types of dose curves, which together describe the electron beam dose distribution in water. Percentage depth dose, or PDD, or beam profile. There are 2 main curves that we use it for define the dose distribution for electron beams. We position a small ionization chamber along the central axis of the beam, as I have shown it in the right figure here. And when we put a small ionization chamber along the central axis, we put the water tank at the SSD of 100 centimeters. It means that source to surface of the water phantom is 100 centimeter. The detector starts near the surface and moves downward step by step, recording those at each depth. Then we normalize everything to maximum dose, set as 100%. It shows us how a dose buildup plateaus and then how it falls off sharply, especially in the electron beams. For beam profiles, we fix the detector at chosen depth, often near maximum dose, and scan it horizontally across the field from edge to edge of the water tank or beam. This maps the lateral dose distribution, showing flatness, symmetry, and how sharply beam falls off at the edge. In here, we have shown the depth dose curve of an electron beam. The depth dose curve of an electron beam shows us the initial buildup region and the maximum dose region. Where the maximum dose happens, we we say it Dmax, or depth of maximum dose. We have shown here as a Rmax. It means that range of 100% dose. And beyond this point, the dose decreases rapidly in the fall-off region due to electron energy loss and scattering in tissue. It is dependent on the electron energy and felt size. As you can see in the figure, there are several ranges: R90, R50, and practical range. We have definitions for all of these ranges for an electron beam. The interactions between the tangential to the steepest part in the fall-off region and the photon contamination part is defined as a practical range. We have shown it as a RP. And Rmax, as I told before, is defined as a depth at which the electron beam delivers its maximum dose in water. The depths R90 and R50 are defined as a depth on the descending part of the PDD, where the dose fall-offs to 90% and 50% of the maximum dose, respectively. In this figure, I have tried to show you the PDD variation with electron energy. It is clear that the range of electrons increases with increasing the electron energy. Also, as it can be seen very clearly, as electron energy increases, Dmax or Rmax shifts deeper into tissue, because high energy electrons penetrates further before losing most of their energy. The other important point is that the dose gradient for lower electron energies is steeper than that for higher electron energies, since the lower energy electrons are scattered at greater angles from their initial direction. The bremistral contamination is higher for high energy electrons and is typically less than 1% of 4 MeV electron and less than 4% for 20 MeV electron beams for a LINAC with dual scattering faults. This table shows the range and dosimetric parameters for 6 to 18 MeV electron beams. As you can see, there is a direct relationship between electron energy and practical range. Practical range value is the half of the electron energy in centimeter. For example, you can see here that for 6 MeV electron beams, if we divide it by 2, the practical range will be 3 centimeter, around 3 centimeter. And the other range, which is very important in radiation therapy, is the R90 or R80, because it is the depth that the prescribed dose delivered. And we define and we prescribe the dose to the tumor. So the critical R90 and R50 are connected to the electron energy very simply by a simple equation. If we divide the electron energy by 3, we will have the R50 or R90 approximately. For example, in here, if we divide energy of 6 by 3, we will have 2 centimeter. 2 centimeter will be over R80 of the, very close to R80 of the 6 MV electron beam. In treatment planning for electron beams, the main thing is the selecting the field size and energy of the electron beam, because field size determines how we can cover the whole tumor region uh, in a lateral dimension, and in depth the energy of the electrons are very determinant factor. For appropriate treatment plan, the target volume should lie entirely within the 90% isodose curve to ensure adequate dose delivery, as you can see here in this isodose distribution image on the right hand side of the figure. So you can see that the isodose of 90% has covered the whole target volume of our PTV, planning target volume. There are some issues should be taken into account, and electron energy increases above approximately 7 MeV. The 80% isodose curve begins to taper significantly due to increased lateral scattering. This tapering leads to a reduction in the useful treatment area, particularly for small field sizes. The construction of the high dose region is more pronounced in small fields, which may result in undercoverage of the target at depth. Therefore, a larger surface field size is often required to adequately cover the target volume, especially at higher electron energies. The other thing that is very important and is used generally, usually in our electron beam treatments, of using of bolus or absorbers. A bolus used in electron therapy just to modify the dose distribution. We put the bolus material on the entrance of the beam, on the surface, on the skin, and it helps to flatten out an irregular surface or reduce the penetration of the electrons in certain parts of the field. By doing so, it also increases the surface dose, ensuring adequate treatment at shallow depth. And also the bolus material should be tissue equivalent with similar stopping power and scattering properties to tissue to achieve the accurate dose delivery. In here, I have tried to show you a case of treatment of skin cancer with electron beams. As you can see here, the patient has a large movable squamous cell carcinoma of the skin, diameter of around 4.5 centimeter, and the depth of the penetration of the tumor is 1 centimeter. I have used this figure from treatment planning books written by Khan, and the tumor extends posteriorly up to 5 millimeter from ear canal and superiorly over the temporalis muscle and brain. Due to tumor size and the need to spare underlying brain tissue, an electron beam was chosen. So because of the finite range of the electron beams, we can irradiate the tumor and avoid irradiating the brain region, which is the healthy tissue in this case. So to increase the dose received by the skin, we should use a bolus. A bolus with 5 millimeter thickness is used. We will put on the tumor region. And to cover the depth of 1 centimeter, we will use the 12 MeV electron beam, which can cover up to 2.5 centimeter in depth. And the other thing here is that we are very close to temporomandibular joint, TMJ joint, and superficial parotid gland. And some doses will be received by these two organs. We should check it and characterize, measure it, or calculate the dose and use special precautions not to overdose those parts, which is healthy and very vital for the patient. The treatment schedule usually around 30 fractions in 2 gray, and total dose of 60 gray in 6 weeks is delivered to the patient. This brings me to the end of this talk, and I have tried to use these books, which is very usual for medical physicists. I hope you enjoyed this presentation and you use this presentation. See you in my next videos.